How does trauma affect the brain and pain perception? Trauma, particularly when it leads to post-traumatic stress disorder, can significantly change how the brain functions and how pain is perceived. Understanding this connection is crucial for those affected by medical trauma, PTSD, and chronic pain. Trauma impacts several key brain regions that are involved in processing pain signals, leading to changes in how pain is anticipated, experienced, and managed. At the heart of pain perception is a network of brain areas known as the pain matrix. This includes the periaqueductal gray, thalamus, amygdala, insular cortex, anterior cingulate cortex, and prefrontal cortex. These areas work together to interpret harmful stimuli and regulate pain responses. When trauma occurs, it can disrupt this network, particularly affecting the body's natural pain control systems. This disruption makes it more challenging for individuals to manage acute pain effectively. For instance, traumatic brain injury, which can occur alongside PTSD, is linked to increased activation in the periaqueductal gray and prefrontal cortex when anticipating pain. This indicates altered pain processing and difficulty in controlling pain responses. The emotional and cognitive effects of trauma also play a role in how pain is perceived. PTSD is characterized by heightened stress responses and increased alertness, which can change how sensory information, including pain, is processed. Interestingly, some research suggests that during moments of recalling trauma, individuals with PTSD might experience a temporary reduction in pain sensitivity. This phenomenon, known as stress-induced analgesia, is likely connected to dissociative symptoms and altered brain activity in regions like the dorsal striatum and thalamus. In contrast, individuals who have experienced trauma but do not have PTSD may report increased pain during these recall moments due to negative emotions. Moreover, trauma-related disorders can lead to changes in how sensory information is integrated and how the brain defends itself against perceived threats. The vestibular system, which helps with balance and bodily awareness, may not function correctly in those with PTSD. This dysfunction can lead to sensory overload and a disconnect between the brain and body, affecting how pain and other sensory experiences are interpreted. Chronic pain is a common issue for those with PTSD. The ongoing changes in brain circuits can lead to a state known as central sensitization. This is where the nervous system becomes overly sensitive to pain stimuli, amplifying pain perception even without new injuries. This condition involves reorganization of sensory circuits and metabolic changes in brain areas related to pain, complicating pain management for individuals with PTSD. In summary, trauma profoundly affects the brain by disrupting the neural pathways responsible for anticipating, perceiving, and regulating pain. Changes in brain function, emotional regulation, and sensory processing linked to PTSD contribute to altered pain experiences. This includes both increased pain sensitivity and moments of reduced pain sensitivity during stress. These neurobiological changes help explain the frequent overlap between PTSD and chronic pain conditions. It highlights the need for treatment approaches that address both trauma and pain symptoms, emphasizing the importance of seeking professional medical advice for personalized care.